Welcome back, everyone, to Neuromuscle Works, where we help you redefine strength. And here's a quick highlight, or healing highlights, as we like to call them. We're going to look at the internal oblique and its connection to low back pain. So, as far as when it comes to low back pain, it obviously has very many variables and different approaches that we want to consider. And so, as far as today's approach, we are focusing on these two specific pieces of tissues or muscles, which is the internal abdominal oblique of the left side and its connection to the thoracolumbar fascia, which is a large piece of connective tissue that runs up and down your spine. Very important for SI joint dysfunction, very important for tensegrity in the lumbar spine. Definitely one of my favorite pieces of muscles and tissues to highlight and work with. But with today's connection, the internal oblique, it tends to be one of the muscles that is more hypertonic on the left side, part of our ham anatomy model. So the hypertonic anatomy model, the internal oblique has a few different components and attachments as far as the origin, one being the thoracolumbar fascia, the other being the iliac crest. And a very important one for all the athletes that I work with is your inguinal ligament, which a lot of issues can develop around there with soccer and any sort of a sport that requires you a lot of hip flexion and sprinting, running, anything that ties into abdominal internal pressure. The inguinal ligament can be related to sports hernias and any other certain conditions that aggravate that hip region. For post-pregnancy, this is also a very good muscle to work with females that have carried a baby for 9 months. And so it's definitely one of those tissues that you can't neglect or forget about. Also connecting to the cartilage, the costal cartilages of the ribs becomes a really sensitive area for most as far as the connections and the adipose tissue that can develop around there. Some lipomas, tiny little lipomas that can develop around the insertion points there due to the instability that we're going to talk about today. So as far as the assessments, they're very obvious whenever it comes to low back dysfunction. Anytime you hold your legs up in the air while you're laying on your back, if you have any low back instability or discomfort, this is a really, really good muscle to help release and restore by working around the insertion points. Once again, one of the muscles for low back pain that we focus on, as far as the actions, it flexes the trunk laterally, it flexes forward, of course. It helps with rotation of the trunk, which is your whole entire upper body, your spine, and just gives you better support as far as anything that requires loading or compressing of the body. A muscle to definitely dive into, help self-release methods, obviously, is holding down pressure points around the hip, down into the inguinal ligament and up around the rib cage. Fun muscle to explore for any therapist, hands-on body worker, or anybody trying to improve their health. Once again, part of the ham anatomy model, the internal oblique. A cool feature that I don't want to neglect is also how the internal oblique eventually becomes the external oblique of the opposite side. Something that's often underlooked or something that's not really talked about often is how these tissues become the opposites of the other side. And when we talk about the six pack, we recognize that there's obviously the bulges of the rectus abdominis, which we can highlight both for this case. As you see the two bulges of the six pack, which we all have to a certain degree, where it dips in, that is the linea alba. But the fibers of the left internal oblique cross over and basically continue onto the opposite side of the external oblique. So external being the most closest to the surface. So the external oblique fibers do become the internal oblique fibers of the opposite side. In a way, it's the muscles crossing through where the external becomes the internal, which is a really, really cool feature. something that most people never really talk about enough, but it really ties in how these patterns throughout the body influence one another. External oblique of the right side and the left internal oblique of the left side. Hopefully you learned something new, and we'll see you next time.